Okay, thank you so much again for making time and joining us for this conversation. So now, with regards to, of course, your career, I know you have spent it at the highest level in global health. You have been at the top of health governance, from ensuring there's access to essential medicines to now co-chairing the negotiations for the landmark WHO pandemic agreement. The theme for the International Women's Day this year is rights, justice, action for all women and girls. So reflecting on your journey, particularly your early work expanding access to HIV medications in South Africa, how did you come to understand that justice, fair laws, and fair systems is non-negotiable prerequisite in health?
Well, let me start by thanking you for inviting me. And I'd like to also start by recognizing and honoring all women from all corners of the world, but particularly in our continent on this special day. Happy International Women's Day. Well, I think you probably know that the South African story about access has been, based on our constitutional provisions that guarantees one rights, women, children, and the rest of the population, the right to health. But I always say that laws and systems alone cannot ensure access, whether for women, for children, unless they're implemented, unless they are responsive, particularly to the needs. And it means in the design of these laws, in the formulation of policies, we have to ensure that they take into account principles of social justice, equity, and gender. And when we had this court case in South Africa, it was at a time and at the height of the HIV pandemic, and the rates of infections were very high, and the burden of disease was quite high. But in particular, something that is close home, close to women, mother-to-child transmission was the core issue that captivated most of the civil society organization. Of course, I was working in government, and there are a number of legal matters that arose at the time. The first was the court case that was brought by the pharmaceutical industry for the provisions that allowed for access to medicines. I think there were multiple provisions allowing for generic substitution, parallel importation, and also, introducing pricing because the cost of medicines were very high in South Africa. So that was the first case. The second one was with regard to mother-to-child, reduction of mother-to-child transmission and access to nevirapine at the time, and civil society to government to court, precisely because they thought the policy was irrational. And I think your topic about justice, fair laws, and systems talks to that in a sense that government had to sit down with civil society and come up with a practical plan that could ensure that a mother-to-child transmission was reduced. And I'm happy that at least there was a dialogue between different parties. Even in the case of the pharmaceutical industry case, we had to have dialogue and agree on them withdrawing the court case. So the South African story is based on the dialogue, and it's also about ensuring that in the dialogue we also protected the rights that are enshrined in the Constitution. So the fairness is also about when we look at women, we have to recognize that um, our policies are responsive and they also protect various categories of women, women in rural settings, women in informal work, young women, older women, women with disabilities. So when we write policies, we should also recognize those categories of women.
That was quite comprehensive as a response. And just to build on the conversation with regards to justice as the foundation of health security, data tells us that women have only about 64% of the legal rights of men. And at the current pace, at the current journey, it will take us around probably 286 years to close the gap. For our audience of global health practitioners and stakeholders, can you translate what legal protection gap means for a woman's daily life and her ability to survive the next pandemic? Of course, when the law fails her, how does the health system fail her?
Well, in the first instance, let's break down this concept of legal protection gap in the context of women's health. In that, in most instances, it's framed within the context of social security. But in the case of women and their survival and the importance of them accessing health services, we need to ensure that the legal protection gap in the context of women's health refers to the discrepancy between global norms that are set by various conventions, for instance, conventions that protect the rights of women and children, but also look at whether at national level our laws capture those rights adequately and that the policies do not, form barriers and then do not undermine those international norms that have been set globally. And secondly, we also have to ensure that in translation of those international instruments, treaties and other legal instruments, we have to ensure that these are translated in such a way that women are not discriminated against, there are no barriers, and there are no structural barriers, actually, and other forms of inequities that undermine women's rights and also access to care, access to services, and also their dignity. So let's acknowledge that gaps exist in our own countries. They exist because of poorly formulated laws. They exist because inadequacies in enforcement of those laws. They also exist because some of these laws are poorly conceived. But others are influenced by cultural norms in certain settings. And I'll talk to that later when we talk about the pandemic agreement and some of the arguments that arose during the negotiations. In South Africa, our constitutions guarantees socioeconomic rights and the right to health and rights of children and women, I think, are enshrined in the Constitution. And for me, that is an important principle. And in our continent, because we've got what I call the youth bulge, younger people, we have to start conversations with younger women about how we protect their rights, even at that early age, girls, and as they progress and as they grow to be older women and so on.
Yes, thank you. Thank you so much. And I know you just preempted discussion on the pandemic agreement, which is somewhat something that I want us to talk about next. And this is just with regards to the gendered analysis. So research again has shown that in the early draft of the pandemic agreement, there was lack of robust gender inclusive language, often treating gender as an afterthought. And we know as the final agreement was being shaped, how did you and of course your co-chair and Claire, the French ambassador for global health, ensure that specific needs and vulnerabilities of women and girls from exposure to gender-based violence during the period of lockdowns to their disproportionate representation in the health workforce, were not just acknowledged but hardwired into the text.
Well, let me start by saying that before I even start talking about the content, let's get into this conversation about women representation, because that is still a sore spot for me. In
Okay.
that, as you know, WHO has 6 regions,
Yeah.
and the manner in which the bureau was established was in accordance with a regional representation, meaning each of the 6 regions had to nominate a representative. Like, as of course, I represented the African region. But I was kind of disappointed and pleasantly surprised that in this day and age, that a region that only had a woman representative was the African continent. The other 5 members were males. So there was no conscious effort to ensure that there was representativity. But it was not only with the pandemic, the Intergovernmental Negotiating Body, even the IHR working group only had 1 woman. And when we had joint sessions between these 2 groups, we had 12 members. And of the 12 members, 10 were men and only 2 were women. But it got worse. For the IHR, when the representative from Asia stepped down, from Southeast Asia stepped down, she was replaced by another man, meaning IHR working group did not even have a single woman. So there was no conscious effort whatsoever to ensure equal representation. At least for the INB, there was an effort to self-correct. When the others stepped down and they were due for rotation, we had a balance. We had 3 women, and this is when Claire joined together with a representative from Australia, Fleur. And we at least had 3 women and 3 men. So that brought about balance because there was a concern repeatedly that was raised. And I think this seems to be standard. People don't even frown, people don't even raise concerns. We must be deliberate and intentional about representation. So I wanted to start there before we got into the content. Now, with regard to content, I wanted to first explain that when we started drafting, we were quite optimistic in that most of the text included language on gender, but with various iterations, the language was watered down, and not only watered down. I mean, the word gender was no longer even accommodated. So the text changed from not having the word at all and to changing it to just accommodating the word women. So, as you know, the structure of this document is such that we've got 3 parts. We've got the preamble, principles, purpose, and we have the substantive elements and the institutional arrangements. So what we could do and what we managed is to at least secure language in three areas. Firstly, in the preamble, the second paragraph, we're able to still retain gender in the text. The fifth paragraph, we have a reference to conventions and the rights of women, children, and those with disabilities, the CEDAW a reference. And we then have reference to women in Article 7. In fact, Article 7 was core because with the initial drafts we had, we recognized that 70% of the health service is actually run by women. And because of that, we wanted that to be captured in the section that deal with the human resource for health. But unfortunately, others said, why are we singling out women? Why not other categories? But it just shows you that some of the regional groupings were quite vehement about the word gender. In their own settings, they've got their own national laws. And their national laws are still, in our view, discriminatory in a sense that they do not allow women certain rights, and they did not want this treaty to introduce those provisions. And they wanted a more neutral language. So at least we were able to protect what we have, and this is the best we could do. And I'm hoping that for those provisions, particularly the first part, the substantive elements in the implementation, will be able to address, those provisions. But I would like to hasten to say that the institutional arrangements provides for the creation of the conference of parties. Maybe one of the key things that we have to do is that when the conference of parties is established, we must advocate for gender balance to be maintained. And it's something that we can start engaging in now, talk to parliaments that are going to ratify the pandemic agreement, appeal to them that they must maintain this balance when the COP is established.
Thank you. Thank you so much. I think from that bit of response, and you've touched on the regional groupings in terms of the geopolitical polarization, and I know with your experience with the negotiations, you definitely had a bit of obstacles in navigating pushback, also building trust. So I want us to focus on a bit of that in two parts. I'll ask two questions. You being renowned for your unique negotiation tactics, and then in a moment of intensifying a backlash against women's rights and the geopolitical polarization. What does it take to build consensus? And then the second bit would be, what advice do you have for upcoming young women leaders in health or in any other sphere who are facing pushback in their own communities, in their own context, trying to advocate for gender equality?
Well, firstly, let me start by saying that, when the negotiations started, it was at the time when we were still wearing masks, when we're still, we're just coming out of this crisis created by COVID-19 pandemic. And there was a lot of mistrust. There was a trust deficit, and for that reason, we had to start by building trust and confidence, because you could feel the tension in the room, but it was also exacerbated by the conflicts that were happening at the time. Because the day we started negotiations, that's when the Ukraine war started. And the that whole session, half the day were preoccupied by statements about Ukraine. But throughout, then we had the Gaza war. So, meaning we've had conflicts throughout, which kind of introduced different issues into the discussions, uh, but which were equally important, because people see conflict as a crisis, and and it kind of deny women and children access to services, and they were bringing those so that this pandemic treaty must not be seen in isolation of the the chronic crisis that countries are always subjected to. So that was the first thing, but we had to be deliberate about uh, identifying the core issues that we thought were essentials, and that would also bring about transformative change. So, in that respect, we identified pillars, but it had to be in a consultative manner, in that we reviewed all the recommendations that were made um, uh, during COVID. Because remember, during COVID, there were reviews and evaluations about what went wrong, what is it that we must do not to repeat this from ever happening again. So there were over 300 recommendations, and we had to take those, synthesize them, and try to collect them into thematic areas. And the four key strategic pillars of this pandemic agreement were about equity, governance, health systems and tools, as well as finance. And we said if those things are embedded in this agreement, I think that will give one a sense of comfort, for the future. So, and it is when we started the negotiations that others said, but we must still have language that refers to pandemic prevention, preparedness, response, and recovery. So we also integrated that language into the document. So it was very difficult in the beginning, I must confess, because we could not even produce the first draft. So we had to collect everybody's idea, everybody. And I think we must never miss that important step, because people want to be heard. People want you to show them that you are listening. You can't go there with your preconceived ideas and think that people will just agree because we are children. You have to take people along with you. It needs a lot of patience. So it's something that you have to invest in, listen, and allow dialogue, allow engagement. Even when tempers flare, maintain your cool as the chair. But of course, there are a few other, tricks that I had to use. Like in some instances, I had to sing for them. when it
Okay.
got when it got really, but not that I can sing, but I attempted.
That's
The,
interesting.
the, the other thing that I would attribute to a successful outcome is that each of the bureau member had to be assigned tasks. So it was not just left to the chairs. So we made sure that each of the bureau member had articles that they were assigned, to chair, to lead, and to drive this. Otherwise, we would not have been able to finish this work in the allocated time. That is the first. The second one is that, I noticed that when countries were in the room and were in formal session, they were more tense, more rigid, and there was no flexibility. They were only interested in reading their statements. And also remember, as they were reading statements, their capitals are watching them in the room. So they didn't have any form of flexibility. So what we did, we introduced informal consultations. So we allowed countries to meet informally and have conversations. They tended to be more relaxed. They tended to talk to each other. There was much more mutual understanding when they were talking informally. But we also brought experts from time to time to come and brief them on specific topics so that there was a kind of common understanding amongst all of them. And that tend to kind of relieve tensions, from time to time. So one of the things that I think we need to improve in future, we wanted a civil society to be in the room as negotiations were going on, but some member states were uncomfortable with that. But I think in the spirit of transparency and inclusiveness, it's only fair to, even if they don't participate in the actual negotiations, just to sit and observe how the conversations are unfolding. We attempted that by bringing them in to come and read statements in the morning, and because though what we realized is that those statements were helpful because member states would listen to them, and then when they look at the text, they'll also reflect on what was said by various organizations, non-state actors.
Right. Thank you.
So
Thank you so much.
my message to young women is that I think we need to be deliberate about setting up programs, even if we can run mock negotiations on topics like at national level, have what we used to call debates, isn't it? Invite young people on a particular topic, let them have some conversations so that they invite politicians and say, look, these are our issues. Let's have a conversation, let's engage.
Yeah.
Don't announce policy and implement without having engaged with us. It hasn't been a form of like you send out a policy and you want written inputs. No, it must be dialogue.
Yeah.
And I find that to be the most effective way of engaging people when you have dialogue, because they kind of become advocates of your policy because they understand it better.
Yes.
And they also have a stake in the matter because it's a policy that affect their lives, and including women, even young men, young, and because you have to bring them along to achieve a balance.
Yeah, and I agree with you. I agree with you actually. The best way to actually when just test your capabilities in your negotiation skills is by actively engaging in conversations. And I know that is something young women and girls would appreciate from this conversation. And also, I just want to point out the fact that yeah, you've really emphasized on being patient in terms of just building trust, then investing time and of course being accommodative of different parties. I think that is featuring heavily in your response, and I think again that is probably one of the most critical bits that of course supported the negotiations. Now, I just want us to narrow down as we come to a close, and I'm just trying to reflect on what actions as a way forward, and sort of the road ahead. We are marking the International Women's Day, which is reminding us that progress is not inevitable. It's actually um, something that requires us, to of course, climb together. We have to be called um, a bridge builder and a hope keeper. What gives you hope as Precious? What gives you hope as you look at the next generation of women and girls who are fighting for their rights and their health? And of course, again, what would be your message uh, for them on this day? Thank you.
Well, I like the concept climbing together. Um, in that climbing together is that they should not climb on their own. Uh, um, you know, we must also pull them as we go up, lift as we go up so that you take others with you. For the next generation and for women, I've looked at the continental data on female literacy, and it's quite uh, encouraging in that for the ages 15 to 25, which is largely youth, um, most countries have reached about 25%, but three others have reached 90%. So obviously there's still a gap for those who have reached 75%. In my view, education is a transformative force. And for that reason, we need to break this cycle of poverty by improving young girls' education and women's education as well, because we know the impact in health outcomes, we impact in socio-economic conditions of those women. And for that reason, I would suggest that we invest where it matters most. Let's have strategic investment, because even for these negotiations, you need women who have certain level of literacy, certain level of education. So let's just have this drive of educating women, because if you educate a woman, you've actually educated a nation.
Yes, thank you. Thank you so much. I like that you finished off with that quote. I just want to take this opportunity to share our gratitude as the Institute for Global Health and Development. We are pleased to host you and, of course, having this conversation shared with our audience. Thank you so much for, again, not just having time off your schedule. I know you're very busy, but again, this is something we treasure most. And we look forward, of course, in future engagements and interaction on different other topics around the work that we do at IGHD, with gender equality, of course, being one of the core areas. Thank you so much,
Thank you
Precious, for your
for
time. And
thank you for inviting me.
yeah, thank you. Thank you.
Okay, and goodbye.
All right, bye.
Bye bye.